Hi, I'm Ryan. I'm here to introduce iamsick.ca. I'm also here with my co-founders, Sherry, Lynn, and Audrey. And together we have a PhD in medical biophysics, a master's in medical biophysics, an honors BSc in computer science, and we bring experience that includes leading a medical group that hosts high-profile healthcare leaders, work experience within 2 health IT startups, and software development experience within government and private industry. We're also working with a team of advisors with strengths in healthcare, technology, business development to create a service that will change the way Canadians access healthcare. We live in a day and age when we carry a supercomputer in our pocket. This one device can tell you where there are traffic jams and can help you avoid waiting in the car in the traffic jam. Why can't the same thing be done to avoid long hours of waiting in hospital waiting rooms? Ontario spends close to $50 billion in healthcare per year, which is about half the provincial budget. Canada-wide, we spend $125 billion, and is not spent efficiently. Canada also sees 16 million ER patients each year, and half of them don't need to be there. It is estimated that treating non-urgent cases in the ER is 2 to 6 times more costly than treating them in a walk-in clinic or a family practice. Also, non-urgent cases add to ER wait times, and the cost of these visits are not only monetary. Recent studies have also shown that Canadians are more likely to wait over 4 hours to receive treatment in an ER compared to many other developed countries. And that's not right. Something needs to be done. And so that's what we're working on. We've developed a mobile-friendly website and a BlackBerry app, and we'll also be soon launching apps for Android devices and iPhones. And our service shows you whether your nearest healthcare options are, which providers are open at that particular moment, whether it's 10 p.m., 7 a.m., 5 p.m., what's the nearest ones that are open at that particular moment. Wait time estimates, and e-scheduling. So you can spend more time at home than in the waiting room. Students will likely be early adopters, so we've leveraged our connections to various campuses throughout the province and country. Since September 2012, we've had support from Carleton University and U of T, which has led to significant usage. In terms of competition, we have 2 main competitors, PatientWay and HealthAware. PatientWay provides kiosks to speed up patient registration in hospitals. We're different from that because we don't use kiosks. We reduce the cost of adoption. HealthAware focuses on promoting clinics by offering online e-scheduling to patients. They focus on the provider, we focus on the consumer, and the patient experience itself. To succeed, we need key partnerships in the Ministry of Health and clinics, and we're in the process of establishing pilot clinics. We intend on charging clinics an annual fee for system integration and maintenance. Patients will be charged a small transactional fee to avoid overbooking, and we will also generate revenue through data analytics, strategic partnerships, and ad revenue. We're looking for $100,000 in seed capital in return for a stake in our company. There are global trends in health IT and the patient experience right now, and you'll be part of this trend if you join us. As Canadians, we all value our healthcare system. Help us keep our healthcare system sustainable, and hopefully it'll be there for you in 20 years.
Thank you. Very interesting. One of the things that if you guys don't know already, but I think you'll learn quickly, is that nothing ever happens in healthcare unless incentives are aligned, and so you can't hurt any of the stakeholders if you want your stuff to be adopted. And it really was not clear to me at all who pays. Like you mentioned at the end, but when you talk about a clinic paying to reduce their wait times, you need to understand that an endless wait list is to the advantage of a doctor. Okay, so that doesn't work. Getting people to pay, very few people will pay. So I really don't understand that model. The other thing is, what's the benefit realization? So I've got a doctor and an ER clinic, and they're packed all the time anyway. So they're packed 100% of the time. You're never going to get rid of emergency room patients. So they're going to have the same amount of people in the back office and the same amount of people up front. So you have to think about how is that clinic going to win? How are they going to realize benefit? So just by making patients more satisfied isn't going to help them. Now, CEOs are getting paid by their wait times and so on, so a little bit. But anyway, the general comment is the healthcare system doesn't really care unless they're made to care. Patients don't pay unless they're in a situation where they normally pay, like Switzerland or US or somewhere like that. And so you need to think of the stakeholders and how you're either helping or not hurting each one of them. And I didn't see that.
Yeah, I kind of thought that this is a product that may be more geared to the U.S. market than here. Because I don't see why government and hospitals would be interested necessarily in populating the data. But the other thing that struck me is you're asking for $100,000.
Yeah.
And whenever I hear a number like that, I think you don't understand your business because $100,000 doesn't get you anywhere. It's a small fraction of what you need. So if you, and it's, I've noticed the last couple of years in TyQuest, there's been a tendency for entrants to really lowball the amount of money they're looking for instead of identifying what the real need is. And you think that's, you know, making it more attractive as an investment, but it's really telling the investor that you don't understand your business.
You mentioned about $43 billion spent by Ontario. 100% of that money is spent by government and nothing is spent by individuals. So if you have to succeed, you have to return your system in terms of helping, improving wait time, etc., and sell it to Minister of Health.
That was our intention, but based on interviews with individuals, we've actually been told that this particular revenue model is preferred, but we can discuss that.
Okay.
On a non-substantive matter, I just can't tell you, do not read your presentation. It has to come out of you naturally. It's your lifeblood, it's your passion. I know you're doing it to be disciplined about time. I completely respect that, but if you're in front of some potential, check writers, you want it to come out of you passionately, that it's natural, that you're not reading a script.
Sure.
But that's all. Thank you.
So two things. A, while you were talking and got interested, I just went onto Google Maps and put open clinics and gave me all the open clinics that are near my location. So I really don't understand why you're going to be more valuable than something like that. A. B, when are people going to download this app? When just before they need the doctor, oh, I'm feeling cramps in my stomach, I got to see if there's an open doctor or not. So there's how are you going to get this into people's hands, right? And that's a big open question that I think you need to overcome and address.
Or should I describe that as part of the elevator pitch, is my question.
So your elevator pitch, okay, since you brought that up, you wasted your first 30 seconds, which are really your most valuable time real estate, on describing the team. I don't care, get to the product, right? And then tell me why you're gonna carry it out. So your elevator pitch needs a lot of work in terms of, here's what I'm doing, and here's why people are gonna care about it, and aligning incentives to the stakeholders. Yeah, your elevator pitch could use a lot of brush up.
Okay, thanks.
Thank you.
Just a general comment though, if you do have a rock star team, it can be helpful in the front. Just that's a quick caveat as well. That's kind of my opinion on that. If you have a rock star team, if you don't necessarily have a rock star team, you can put it a little bit later. The purpose of the start is to build some serious credibility, and if that's going to be from your product, you should do it that way.
If I may, a rock star team, in my opinion, would be somebody who's had one or two successful exits.
No, exactly. Yeah.
Right.
Yeah.
Just to qualify
Yeah.
for an investor.